Hi, welcome. Uh, Today I'm going to be talking about the MSW course again. Uh, Basically, PSW, Psychiatric Social Work. Psychiatric Social Work is a specialized branch of social work, and to become a psychiatric social work, we have to uh, do MPhil, which is a rigorous course. MPhil in psychiatric social work, which is in hospitals. It's quite rigorous, 2 years training where you have to work in clinical setting, working one-to-one with patients. This course, after doing this MPhil, psychiatric social workers, ये जो टैग जो है ना, ये लगता है after doing your MPhil. And people who have done MPhil in psychiatric social work and have become psychiatric social worker, they cannot be compared with the amount of exposure which a person who has done MSW in psychiatric social work and calling themselves as psychiatric social work. You got it? So these two are not equal because there is difference in the amount of exposure. So the person who has done MPhil has more exposure, more skills, and more clinical knowledge than the person who has just done MSW and calls himself or herself as psychiatric social work. Okay, so there is a lot of confusion. People just call themselves as psychiatric social work just after doing their MSW and doing specialization of medical and psychiatry, which I believe requires very clear instructions and guideline for all this confusion, so that this kind of confusions can be removed. Many times authorities who are recruiting people, they also are in confusion. They recruit psychiatric social workers, but the eligibility criteria and every detail that they are asking for is all talking about FSW level, which doesn't do justice for the profession that they are wanting to recruit. So these are some confusions and dilemmas which are floating currently in the job market, and this we as psychiatric social workers who have done our masters, then done our MPhils, and then doing the higher studies, more than 3 to 4 years of experience in direct work in the hospital setting with dealing at least 30 clients in a week, no less than 30, and then we have to go out and compete with people who do not have this kind of exposure, but just because people are confused and do not have the clarity of the role, so they question us. So this is very saddening, which is why I thought I should make up a video on this. MPhil psychiatric social work, I have been getting a lot of questions in the videos of mine. MPhil psychiatric social work, yes, MPhil जाने वाला है from this year, probably they will make a new course, but those who have done MPhil, उनका the degree might not exist, but the profession is still there. And MHCA 2017 still says कि the eligibility of a person to be called as PSW is 2 years of MPhil with supervised training. That is still existing in the law. So even if the MPhil course goes away, the profession is still existing. So you don't have to worry. If you are planning to get into this course, maybe this is the last chance in this year to get into this MPhil. After this, it will get converted into some other degree. So if you want to still get into, I think there's 1 or 2 institutes still open for this year, can get into. Otherwise, it's okay. If you want to be a psychiatric social worker, then later on when the new course comes, then probably you guys can get into it. Okay, so this is my video, random thoughts on the whole confusions that people are having regarding this profession, and I really hope it helps and brings clarity to people. Thank you.